Deborah said, I'm Dr. Kate Earle. I am work with the pain. I am the pain management department at DoveLewis. I work with a lot of chronic pain cases, and I've been a vet there for quite some time. I'm also certified in veterinary acupuncture, and I'm a certified veterinary pain practitioner. So what I'm going to briefly present, which I think is something that is an easy thing to do that can be very helpful in a caregiving role, both for our pets and for ourselves, is talking about basically the power that music can have. So to begin, there's a great historical context for music therapy. There's evidence from multiple cultures about healing music that was used as a means of, trying to provide either mental or physical support. And it's interesting is that the first sort of major documentation here in the United States was in veterans hospitals in 1900s, post-World War I, where people started playing music in veterans' homes to help with both physical and psychiatric ailments. And then what's even more relevant to us is that there's been a very big recent upsurge in interest with music therapy on the human side and also by extension veterinary side, because we're looking for alternate means of managing pain and anxiety in the age of an opioid crisis. So ways to non-pharmacologically manage these issues that we come across. So real briefly, we'll talk about what pain is so we can kind of understand why music can be helpful to mitigate that. So up there, you can see sort of a very clinical definition of pain, an unpleasant sensory and emotional experience or perception associated with actual or potential tissue damage or is described in terms of such damage. What I think we should take from that is the sensory and emotional component and also the perception. It's how we see pain. So everybody, including our animals, have unique individualized perception of that. And acute pain is what serves a protective purpose, right? So it's when we touch that stove and we immediately learn that's not a good idea, and it will resolve after an expected time frame. So if you get a burn from that stove, once it heals, you shouldn't have any pain anymore. But what we see more with our patient, the pets we're caregiving for, and even in ourselves, is chronic pain, which is a different beast. It's pain without purpose. It's pain that's persisted past the point where we think it should be better. And ultimately, it's pain as a disease state that can impact quality of life. And what this graphic shows is essentially pain, anxiety, and depression are all feeding into each other. So if you have experienced chronic pain, you can be more anxious about other painful things. Being in chronic pain can cause you to be depressed, and all those things can make pain worse. And I think how this speaks to our animals too is we can't ask them if they're feeling depressed or anxious, but certainly I think there's a very big social affective component that we do see in the fact that they might get withdrawn or things like that because mentally they're just not feeling well. And again, I think that music therapy is something we can do easily to try to alleviate some aspects of that. So why does it work? There's a whole lot of kind of very technical literature, but one of the things that's most prescient about why it works is that the parts of the brain that process both pain and music have significant overlap. So those parts kind of use the same portions of the brain. So what that means is when you're listening to music and you're in pain or during a painful process, it actually changes the focus and concentration from that pain to the music. And that can make that pain substantially less in that situation. Another thing is the power we have with music and positive emotional association. So you may have your favorite album, your favorite band, but listening to that album can just make you feel better. So that emotional component can also override pain and negative components that we might have. So here's some studies or reflections of studies they've done in people. So with music and acute pain, so this we could think of in terms of surgical pain. So we know if someone's going to get a mastectomy and arthroplasty, there's certainly going to be some discomfort involved. But what they've demonstrated in multiple studies is that by playing preoperative music to these patients, it actually decreases their pain after the procedure. And they do this in people by, documenting how that population needs less morphine or less of whatever intervention. They've also demonstrated this in just waiting in emergency rooms, which is very, applicable to what I do a lot, also physical therapy. But other thing is when people are undergoing conscious procedures using local blocks, if people are playing music, that decreases the pain. And why I find that particularly interesting is when you're having your arthroplasty and things like that, you're anesthetized. You don't know what people are doing to you. But when you're having a conscious procedure, you can see the needle, you can see things happening. And even though you're being made relatively pain-free with local blocks, et cetera, the anxiety and the pain are less because of the music in these situations. Music's been demonstrated in the terms of palliative care. So talking to people on hospice, music can have a very powerful effect. One thing is just promoting relaxation. When you're in a situation with end of life, it can be hard to relax, get sleep. And certainly the music has demonstrated that it can promote that in that patient. And then an increased sense of well-being. Again, that goes with those positive emotional associations that we have. And ultimately decreases anxiety. As we just spoke about, if you have less anxiety, it's going to make more of your experience in the present positive in terms of both pain control, but in terms of just that social, depressive component we can fall into, it can bring it a little bit more positive. And this is a really fascinating kind of broken down from, I call it the environmental effects of music. This was taken from a case series of what happened during COVID. So they played a lot of actual music in these ICUs where people were being mechanically ventilated and treated. And they actually found that people that were, pretty much sedated on these ventilators actually showed with their physiologic parameters, so things we measure like heart rate, respiratory rate, how well they're breathing, were actually better with the music because on some level there was some increased comfort. And there was a theory that it's due to the fact that sort of their fight or flight mechanism was downregulated. Those patients that were recovering did tend to recover faster with music therapy. And then what I think is especially important in terms of this group is they took music, and it was just, I think, just literally just a loop of different classical music in a break room. And these nurses who were, treating these patients, caring for them, would just go in there for 30 minutes and sit with the music, maybe eat their lunch. And they reported feeling much more able to continue with their work afterwards versus people who just went into a break room that had no music at all. So what type of music? So most of these studies were done with classical music, which we know can be soothing, and typically a slow tempo. So not a crazy fast, lots of drums, lots of crazy violins, but more of a mellow sort of musical style. And then also with people, what they've determined is actually self-selected music is most powerful. So music that you listen to, that you have ownership of, that you enjoy, can actually be the most powerful music for you. Obviously for our pets, we can't do that because they can't express to us their preference necessarily. But in people, it certainly is powerful. And then one of the more recent studies was actually the value of nature sounds. So they did a study where they had a select group of patients. It's a psychological study where they're basically being put on purpose under stressful conditions. And they had in the text of that study, they had some people listen to just classical music. Some people listen to white noise. Some of the patients listened to nothing. And then some people just listened to nature sounds like a running stream. And they found that the patients that ended up being less stressed and less anxious during the tasks, actually, they showed that with both the classical music and the sounds from nature. So I think that's really interesting because we live in the beautiful Pacific Northwest, and those are two things we can readily combine for ourselves, listening to music outdoors. So what about our pets, which is our favorite? So music and dogs actually has been pretty extensively studied for veterinary medicine. It's been studied in terms of kenneling, so dogs that are at a shelter or just being kenneled at a boarding facility. It's been studied in terms of its effects in both pretend veterinary visits and actual veterinary visits. And then we also have looked at it before, during, and after surgery as well. And most of what we've seen and we've focused on is the behavior of the dog. So are they more relaxed? With the intraoperative, we're looking at basically, does it take less medication to keep them asleep than the ones that aren't having music? So you can see that dog with his headphones. So what kind of music works for dogs? So when you look at these studies as a whole, classical music at low volume seems to be the sweet spot for them. They do not like heavy metal music. They did 2 studies where they played them that along with pop, and the dogs were very agitated with heavy metal. So Probably not a good one to try, but they did find that switching up the playlist was important to avoid the dog becoming habituated to it. So they saw initially a positive effect, but when they kept playing the same thing on loop day after day, the dogs didn't respond as well. And then there are, if you look out in the marketplace, there are things called music made for dogs. They actually did study that in comparison to classical music. And they actually found that the made for dogs was not any more effective. So I think dogs with just straight up classical is just fine. But what about our cats? The studies that have been done have predominantly been about decreasing stress during veterinary visits. But what's interesting is cats are magical creatures and they really do like music for cats. So the David T's Music for Cats he has now 2 volumes, and those albums have been demonstrated in a few studies where the cats prefer that. And it's basically kind of like ambient classical, but there's also purring involved and like babies nursing. So those sounds seem to kind of help the cats relax as well. I think classical has also been demonstrated. And if you go on things like Amazon or Spotify, there are calming music for cats sort of playlists. But this music for cats, I know you can stream on Spotify for sure. And it is pretty interesting how it's been pretty powerful for that group. So, what can we do? How can we bring this into action with us caregiving for our pet? So here's a few things to think about. So choosing to play music during established quiet time during the day. When you're relaxing at the end of the day, you've done all sort of the things you need to do to keep the ball rolling, giving your pet, that time, even if it's like around, after dinner time, things like that. And then also using it if they're anxious, if they, are having a bad day, playing some classical music to just see if that can, take the edge off. Then also it just increases relaxation. So maybe at nighttime when you want them to kind of settle down, it's a nice thing we can do to help promote that. And then what I think is, what's means of providing that care and connection when you cannot be there. I mean, people leave on the TV and stuff like that, but certainly leaving them with some classical music, we know it can have affect their anxiety, and and you also know what they're listening to. So that's kind of a win-win for everybody. And again, to review, classical music's the best for your dog at this point, and definitely change it up. Music for cats is music for cats, and they seem to like it. And then using it daily is something that I think would have benefit. And then for us, it's very important. So, using music to increase our own relaxation and rest. As I already mentioned, utilizing both music and nature just to hard reboot, to reset ourselves. If you don't have a favorite music that springs to mind, classical is a good starting place. But as I said, I think there's a lot of value to make a playlist specific to you and your likes, or listen to a specific album that you have positive associations from, whether that was an album you heard a lot when you were carefree in high school, or, whatever your positive associations are. And then, even utilizing music as a mental break or a way to relieve anxiety when you just need to step away, even if let's say you're preparing stuff for your pet, caregiving, preparing to get all that stuff together, listening to music while you do that can kind of relieve some of that anxiety. And then ultimately, I mean, this is our goal, right? I mean, I think this is what we should be doing. We should put our headphones on so we're not, we can have our music, but our dog or cat can be sitting there and listening to their music, and again, I think it's a great way and very cost effective and beneficial that we can do every day with our pets.